Good afternoon. I'm Jane Kim, Dean for Academic Affairs and the KT Lee Professor of Health Economics at the Harvard T.H. Chan School of Public Health. It is my pleasure to kick off this event on behalf of our Dean, Michelle Williams, who can't be with us today, but is an admirer of our special guest. I welcome all of you today to this program entitled No One Should Be Shocked, the U.S. COVID-19 Response Failure and More, a conversation with Ed Yong, science writer for The Atlantic. The program is moderated by Meg Terrell, Senior Health and Science Reporter for CNBC. The program is co-sponsored by the Office of Education, Health Communication Concentration, and the Department of Global Health and Population, and hosted by the Forum at the Harvard T.H. Chan School of Public Health. I would like to thank Professors Nancy Turnbull, Vish Vishwanath, and Marcia Castro, respectively, for their essential contributions to this production. COVID-19 has now killed more than 1 million people around the world, and 1 in 5 deaths have occurred in the United States. Despite all of its advantages, the US has been ravaged by the pandemic, leaving Americans frightened, angry, and confused. Communication from public leaders has been confounding, inconsistent, and sometimes contradictory. Our guest today, Ed Yong, has been providing clear and in-depth reporting on the many intricacies and mysteries of the deadly virus and how it affects Americans in myriad ways. His reporting is honest and unapologetic and has been welcomed by millions of readers. Ed Yong is an award-winning science writer for The Atlantic. His work has appeared in National Geographic, The New Yorker, Wired, Nature, New Scientist, Scientific American, and more. His first book, I Contain Multitudes, is a New York Times bestseller. Ed's reporting has been celebrated with numerous awards, and this year, the Poynter Institute declared that he wrote the sentence of the year. But it's his recent in-depth reporting on the coronavirus pandemic that has been singularly important and why we are delighted to speak with him today. Ed's reporting is at the convergence of quality journalism, science, and public health. Indeed, his writing stands at the forefront of understanding this devastating disease and the new world it has shaped that we all live in today. With that, I'd like to welcome Ed Yong, our special guest, and our moderator, Meg Terrell, Senior Health and Science Reporter at CNBC. Thank you both for helping us have this important conversation today. And now I'll turn it over to you, Meg.
Well, Dean Kim, thank you so much. And I'll just add my appreciation for Ed. I'm really excited to get to have this conversation with you. And I know a lot of folks out there are really excited to get to hear from you as well. And to kind of add to why I think your work is so appreciated, especially right now, you take these incredibly big picture ideas and you organize information in ways that really helps us understand what's going on. And your work examines the human nature part of this that really is the reality of what it seems like is driving much of this pandemic, not just policies. And your writing, of course, is just beautiful. I wanted to read one of my favorite lines from your September article about America being in a pandemic spiral and why the coronavirus is such a wily adversary, really. You write, the coronavirus spreads quickly, but is slow to reveal itself. It can take a month for infections to lead to symptoms, for symptoms to warrant tests and hospitalizations, and for enough sick people to produce a noticeable spike. Pandemic data are like the light of distant stars, recording past events instead of present ones. This lag separates actions from their consequences by enough time to break our intuition for cause and effect. So we're going to talk about that. Another line that I wanted to read was from your September cover story, How the Pandemic Defeated America, about why we're in this situation. You take this long look back about our interaction with nature and why viruses are seemingly coming ever faster towards us. You're right, humanity has squeezed the world's wildlife in a crushing grip, and viruses have come bursting out. It's beautiful, it's terrifying, and that's where we'll start. Ed, thanks for being here.
Thanks so much for having me. I'm really looking forward to this, and thank you, Meg, so much for doing this.
Oh my gosh, my pleasure. So just some housekeeping before we get going. Welcome to all of our viewers with us on Zoom, on Facebook and YouTube, anywhere else you might be watching. We will take questions from Harvard Chan faculty and other invited guests. And you guys too can submit questions here in Zoom with us, or you can email them to theforum@hsph.harvard.edu. or post to Facebook at Harvard Public Health. With that, Ed, let's start with kind of where we are in the pandemic. You know, your big pieces were from late August, early September, kind of looking at where we'd come. And as you can see here from COVID exit strategy, things have only gotten worse right now. Look at the number of states that have uncontrolled spread. How would you describe what's happening now?
Well, I'm no expert, but looking at this map, that looks bad to me. I'm going to go out on a limb and say that's bad. We are in either the third, depending on how you look at it, we're in the third surge because, we have the third obvious peak in case numbers. We're in possibly the second wave in that a lot of places that were hit really badly at the start of the year, especially in the Northeast, and had so far controlled the virus for much of the summer, are now seeing rises in cases again. Or you could argue that we're still in the first wave because we never really managed to fully get the pandemic under control. However you want to count things, I think the numbers of cases and the number of deaths speak for themselves, that this is a truly monumental tragedy for the nation and for the world. And I think we're looking at a difficult set of months. Now, the last time I wrote about the pandemic spiral piece, when I wrote the pandemic spiral piece, which you quoted from, I spoke to a number of researchers who felt that the events of the fall and winter were going to be difficult to predict. So most of them felt that things were going to be bad. A lot of them weren't sure whether things were going to be catastrophically bad, like how bad was it going to get? And there are a number of factors in play there. Clearly, doctors are getting better at treating this disease. It's not that miracle drugs have shown up. I think it's just that basic medical care has become more savvy. And so you're much less likely to die from COVID-19 if you get it now than if you did in March, when it was first really pummeling the US healthcare system. I think people are just generally more savvy too. We now have clarity on the use of things like masks. A lot of the, we might be experiencing pandemic fatigue, sure, but I think the concept of social distancing is nowhere near as alien and unusual as it was in the spring. So there's a lot going for us, but then again, it's the weather is getting colder. A lot of places are getting to a point where people are going indoors. We've already had outbreaks because of the often unwise decisions to reopen colleges. We're going to go into Thanksgiving and Christmas, times when people usually gather from disparate parts of the country for long periods of time, talking indoors, all the kinds of conditions that make for easy transmission of this virus. So I think the trajectory doesn't look great. And I think there are many reasons to be concerned about the months to come, not least of which are the following. We still have a president and an administration that is reneging on its duty to control the pandemic, and that have now actively decided to pursue an ill-advised herd immunity strategy. Whether that kind of active negligence is going to be any worse than the passive negligence through incompetence of much of the year, I'm not actually sure, but it's certainly not going to help turn the tide. And I think there's the fact that, as I alluded to in that pandemic spiral piece, people are getting tired, and I think people are getting habituated to the horrors that we're seeing around us. We have hundreds of deaths every day, thousands of new infections every day. Is that going to just become part of the background chatter of our lives? Are we going to normalize to that degree of horror? I don't know, and I fear that that's what's going to happen.
Yeah, and as we go into these months where it's expected to get tougher, I mean, as you just pointed out, we have the same administration. And in terms of a federal plan, I interviewed Secretary Alex Azar on Monday night at the Milken conference, and I asked him, what is the national plan? Can you lay it out for us? And he laid out what they had already done in terms of travel restrictions and improving care, getting drugs but he said now the plan is reduce cases, reduce hospitalizations, reduce mortality until we can get monoclonal antibodies and vaccines. And obviously, cases are going up, hospitalizations are going up. In many states, deaths are now rising as well. How do you react to hearing that that's our national plan?
I think it's all well and good to say we're trying to reduce infections, hospitalizations, and deaths, but I don't really see a ton of evidence of that happening, especially with this talk of herd immunity. Like just leave that aside. Like, look at the facts on the ground. We still don't have enough testing. We still don't have any sort of coordinated effort to roll out the kind of testing plans that folks at Harvard and other institutions have called for. People are still, hospitalizations are going up. Doctors and nurses and other healthcare workers are once again struggling, and they still don't have enough PPE. An absolutely ludicrous situation, considering that this is now in October. So many of the problems that have, befallen the country throughout the year are still at play. And I think that this idea, there's something about Azar's statement about trying to sort of buy time for therapies and vaccines to come into play that I think betrays some of the weakness in thinking of this administration, that the idea is always going to be to sort of wait for the biomedical silver bullet that is going to save us. And, if it's not things that won't actually work, like hydroxychloroquine, it's things that might work, like a vaccine or a monoclonal, but none of those things are going to be like panaceas in their own right. Even if we get an exceptionally effective vaccine, which we may not do, it's going to take time to roll that out. It's going to take time to actually work our way through the logistics of getting a shot into people's arms. And what are you going to do in the meantime? We still need testing. We still need public health. And this idea that instead of investing in the prevention of disease and the social factors that influence whether people are going to get infected or not in the first place, we put all our chips into treatments, into hospital-based healthcare. I think that's just wrong. And I think that is sort of counter to this supposed idea of reducing infections and deaths.
Mm. Well, so we're less than 2 weeks out from the presidential election in the United States. Associate Professor Bill Hanage has a question for you about how to think about this, the political situation that we're in and how to talk about these important topics. Take a listen from Bill.
How do you do science reporting in an environment like this, where there's such incredible partisan political polarization that where you stand on a scientific issue, which is a matter of science, it's a matter of asking questions of nature, can suddenly be instantly becoming something where 50% of the population thinks one thing and the other 50% of the population thinks the other, and all on the basis of what somebody has put in a tweet?
It's very challenging for sure. To begin, I find it amusing being asked questions by the people who are usually my sources. That's not how this is meant to work. I ask the questions around here, but I think Bill's hinting at something really profoundly important, and I think incredibly difficult. He's right that. So let me phrase it this way. My hands are bound by the nature of the job and by the ethics of the job. Our job as reporters is to tell people the truth, and the mandate to talk about the truth and talk about things that are evidence-based and to be honest and fair overrides any desire to appear politically neutral, especially at a crisis moment like this, where the party in power and the administration that is meant to be leading us has failed so badly. We need to be able to talk about that. And we need to be able to talk about everything else besides that. The types of measures that are going to keep people safe, that are based in in evidence and in rigorous science, we just need to be able to talk about that. And yes, we are in a very difficult situation where such messages have been heavily polarized, and where we stand to immediately lose proportions of our audience if we talk about things that are either empirical, weirdly, or that criticize people on one side of the political spectrum. But that cannot be the thing that sways our approach to the work. The work has always has to be about being honest, and being fair. And I do still think that it can make a difference. Like, it's not going to sway the people who turn up at like a Trump rally, or who like, send me emails saying that I did a Control F search for Trump in your piece, found something critical and decided to stop reading, and yet somehow found the time to email you. That's not going to happen, right? But there are plenty of people who are trying to make sense of what has happened this year. People who, even if they, were very, very heavily invested in a political party, are seeing the results of negligence during this pandemic, are seeing their own loved ones get sick and get hospitalized and die. There are people who are trying to make sense of that, and I think that by being honest, we can reach people who might not have listened to us maybe a year ago, 2 years ago. I've had emails from readers who have found the pieces that I've written helpful in reaching conservative friends and family, who've used those pieces as ways of bridging the political divide. And even when those pieces have elements of political criticism in them, I think they have value in that regard. And that gives me a little bit of hope that there are still, we always see so much from the extremes. And I think it sometimes obscures the very messy middle ground that is very much still in play.
Well, I wonder if you could talk a little bit more about that pressure to appear neutral that I think all of us journalists feel very strongly. And of course, this has been a huge topic, back to 2016 and the mistakes that the media made covering that election. That pressure is real. And what do you perceive the impact has been on coverage of this pandemic, in either feelings yourself in terms of, how will this be perceived? What kind of results am I going to get? Or in what you observe out there from us, from the rest of the media community, in just feeling so acutely that pushback? I mean, I'm concerned about even mentioning Election Day, because even just writing the words Election Day, I'm going to get somebody telling me I'm partisan on one side or the other, even if I don't say anything that has any sort of opinion based in it.
Yeah, it's. I think it's, as you said, this is a debate that journalists have been having for years now. Throughout this entire administration, well before that. And I think my take on it, in the last thing I said, I repeatedly talked about being fair and honest, and I think that those are our, those should be our guiding principles, much more than any sense of false neutrality. I want to write things that are true, and when I talk about fairness, I mean like accurately representing what different sides are saying, but also then like arbitrating whether some of those are inaccurate or not, right? Like I'm not just going to write down what everyone is saying and leave it at that. I think especially now, in like more than ever, given the stakes at play and given the many conflicting sources of information that include the highest echelons of power in this country, it behooves us to not just act as stenographers. We have to do our duty in assessing the validity of the things that we're hearing, of helping our readers make sense of conflicting messages and of untruths. And I think that is the principle that should guide us much more than any desire to to not seem partisan.
Mm. So there was one 212 word sentence that the team here highlighted being the talk of Twitter. I think we can show everybody this one. This is one sentence. And this is, of course, the source of the title of this, this panel. No one should be shocked. Tell us about how you felt when you were writing this sentence.
Okay. So if you're talking about how the pandemic defeated America, which was the mandate of this piece, you cannot not talk about Trump. Like, he is not the only aspect at play. And indeed, much of the piece talks about pre-existing vulnerabilities in America that go beyond this administration. But he is very central to what has happened this year. And the challenge of talking about Trump's problems with the pandemic, of which there are many, is that there are so many of them. I think no one, even people who dislike the president, are not going to stick around for like a whole page of all the things that Trump did wrong, because there are a lot of them. But you do have to talk about many of them in order to get across the full scope of, incompetence and malfeasance throughout the year. So that sentence really started with me just writing down a list of bullet points of like the most important things to talk about. And then suddenly thinking, maybe I could just throw in a ton of semicolons here and make this one sentence, one paragraph. Partly that is there's a stylistic choice there. I do think that a lot of readers are suffering from Trump fatigue. Like, people have had enough. And I think so whatever you write has to be brief, and it has to be comprehensive but punchy. I also think that the sentence does a very specific thing that indeed the rest of the piece does, which is to very specifically argue that everything we have seen this year, all the failures of America's pandemic response, were predictable and preventable. Like, they are based on vulnerabilities that already existed and that had been widened. And so when you talk about Trump, the sentence is really arguing that everything he did this year again reflects qualities of his character that were entirely obvious beforehand. I feel I have some authority to speak about this because I did write a piece in December of 2016, after the election and before his inauguration, saying exactly how Trump would react during a pandemic. And okay, I did not predict that he would himself get sick and try to brush it off and not learn anything from it. But I did say, he's going to tweet rashly, he's going to buy into conspiracy theories, he's going to go for border control and other similar measures, he's going to ignore the advice of experts, including the CDC, etc. And so he did. And that's not like, I don't claim to have any sort of massive precognitive skill here. It really is just looking at his statements during the Ebola epidemic, during his election campaign, and extrapolating forward to think about how he would handle a crisis much like what we faced. And I think sort of going beyond Trump, like, this is a thing that I've tried to do more generally in these pieces, that someone described it as the journalism of evidence-based imagination. So trying to look at what we know and use that to make some sense of what is to come. And it's not quite about predictions. A lot of people say things like, "Oh, you saw the pandemic coming." Like, I did not. I wrote about the possibility of it, and this isn't quite the same as like forecasting. It's more trying to say, based on what we know, here is what we can like reasonably guess about what is to come. And especially at a time when there's so much uncertainty, so much upheaval of our regular lives, I think that fulfills a valuable public service. I think it roots people and it gives them some sense of a path ahead, even if that path doesn't look great.
Well, asking you to use your evidence-based imagination a little bit more. How crucial to the pandemic response do you think the upcoming US election is?
I think the stakes couldn't be higher. Endorsing a candidate is above my pay grade, but I will point out that we have now run the experiment of what happens when you have a country with every possible advantage going into the pandemic, but a president and an administration that is dismissive of evidence and expertise, that does not provide clear and calm communication to citizens, and that doesn't have the wherewithal to lead a coordinated national response. We've seen exactly what happens, and it's not good. And while I know that scientists are fans of reproducibility, I don't think this is an experiment that we want to rerun or can really afford to. In some ways, one of the very, very few and small mercies about the pandemic has been that it happened in 2020 and not in, say, 2017. We have, given that political negligence has been so core to what we have seen this year, the fact that we have an imminent opportunity to try a different path is not one that I think we should take lightly.
We've got a question here, switching directions a little bit, from another person I know that you talk with who now wants to ask you for your expertise, Michael Mina, an assistant professor of epidemiology at Harvard. Let's take a look.
Hi, Ed. Thanks so much for joining us here at Harvard. When I talk to reporters, I often feel like I'm gambling or rolling the dice about whether or not the message that I'm trying to convey of my science is really going to be reported in the way that I expect. And the real question is, what are steps that we can take as scientists when we talk to you and your colleagues to ensure that the message we want to get across to millions of people is truly getting across in the most accurate way?
Yeah, it's a really good question. I will say that firstly, that I very much sympathize with what Michael's asking about. Before I was a journalist, I was a public information officer at a cancer charity. So I did like hundreds of interviews with reporters on the phone and TV and radio. I know very well what it's like to be misquoted or to be misrepresented. And so I sympathize a lot with sources who have this problem. That being said, on the other side, I also recognize that I am not here to be a Harvard spokesperson. I am here to, and I'm not writing for my sources. I'm here to write for my readers. And to the extent that sources might differ or might say things that I have questions about, I'm going to do my due diligence to try and represent a wide range of perspectives and to try and integrate and arbitrate across different lines of expertise. What can scientists do about that? I think there's a tremendous value in being clear, in being very precise about what you're saying. I think there is a huge amount of value in pointing out things that people get wrong about the thing that you're being interviewed about. So sometimes I specifically try to do this. I have asked people, what is a thing that journalists get wrong about your area? Or what is the thing that is most likely to be misconstrued about this big idea? And that helps me as a reporter to know what pitfalls to avoid. And they can be very subtle things. They can be little ticks of language or little areas of nuance that I might not even have thought about as being problematic beforehand. And I guess what I'm trying to say is you don't have to wait for me to ask that question. If you have concerns about you know, if you have concerns about not being fairly represented, you can say things like, this is the most important thing that I have to say, or here are the things that people have got wrong about this idea before. You can even anticipate some of the, like, you know, people like Michael have been on Twitter extensively talking about things like rapid testing. And so, you know, Michael knows what the most common counter arguments are to that proposal. And like, as a reporter, I will be reassured hearing those counter arguments and his counter arguments to that in an interview. Like, you can do a lot by just sort of preempting. And I think one thing that reporters, you know, I'm sure you find this as well. I think one thing that makes us, that raises our hackles is the sense that someone is trying to play us. You know, the sense that someone is trying to, you know, withhold something or not talk about something. That I think the more open and transparent and clear you are, the better that sort of transactional relationship will be.
Yeah, I absolutely agree with that. And I also, you know, want to express how grateful that we are as journalists that all of these experts have been out there talking with us. I mean, you wrote a piece about how all the experts are exhausted. It's not just the experts, the doctors, everybody who is doing all of this work, but I can only imagine what everybody in this field is feeling like.
Yeah, it's tough, right? Because I think, you know, as journalists, we always have to maintain a slight tension with our sources, right? We're not like, they're not our friends, you know, we're not like their PR people. But that being said, you know, I think a lot of us are in the same boat. Health journalists, the people who we're talking to all the time, you know, everyone is very tired. You know, I feel it in my bones, and I think I can hear it in the voices of the people I'm interviewing. And there's sort of there is an inescapable level of like shared experience there that I think. You know, that I feel very strongly, and I think it's interesting trying to sort of navigate that tension of like journalistic impartiality, I guess, but also recognizing that like we're all in this together and we're all very tired together, and recognizing that it is a huge ask on our sources to give up, you know, half an hour of their time all the time to talk to us when they have a ton of other interviews, a ton of other responsibilities. And the people who are most, you know, the people who have the most amount of expertise and the most amount to offer the pandemic response are also the people who have the most number of interviews, the most number of papers to review, you know, the most number of other responsibilities at play. And, you know, I am grateful for the time, very, very grateful.
Yeah, absolutely. You know, you mentioning just how tired you can hear people are made me think of Dr. Fauci. I don't know if you felt the same way by watching his appearances. And of course, he had that vocal cord surgery and his voice has actually improved after that surgery. But I've observed over the last few weeks, he just sounds and looks maybe more tired than he had been back in the spring. And it's been, you know, 9 months of this nonstop. So that's understandable, but he's also being attacked by his own administration. And we've seen in just the last 2 days, this real rallying around Dr. Fauci from the scientific and medical communities. I watch almost everything he does, and I've, you know, seen him accept awards and just seen this outpouring toward him. But I wonder, what are your reflections on what has happened in our country with Dr. Fauci?
It's funny you should ask this, actually, because I interviewed Tony yesterday for half an hour for another story I'm working on, and it's the third time I've spoken to him over the pandemic, and I think you're right. He sounded audibly more tired, and I think just a little sadder than I've heard him before. You know, he always has, you know, he's got the accent, he's got the, you know, the very upbeat attitude. And I think it's, you know, I think he is also burning out. I think a lot of people are burning out. And it's got to be weird to be someone who is, has so much experience with this. You know, Fauci advised every president since Reagan on epidemics. And yet to be in the position where you are having to fend off Oppo research from the administration whom you are also trying to help, at a time when your service has been more needed than ever. I can't imagine what that is like. I can't even speculate what that is like. And and to sort of do it at a time when you are like, at the one hand, like many people involved in the pandemic response, he is getting threats, death threats, and on the other hand, there is Tony Fauci merchandise. There's a Fauci racehorse. There's that's those polar extremes of Tony Fauci, the arch nemesis, versus Tony Fauci, suddenly the idol of millions, like a household name. In some ways, it's a weird microcosm of the extreme polarization that we've seen throughout the entire pandemic.
Yeah, that's really nicely put. And I look forward to reading your article that you interviewed him for. Getting back to some of the questions from Harvard faculty, we have one here from Joe Allen, Associate Professor of Exposure Assessment Science, asking about one of the consequences of this pandemic. Here's what he's asking you.
Ed, first, I want to thank you for your reporting and writing. I think you've written the single most important piece to date on the pandemic in The Atlantic, How the Pandemic Defeated America. And it opened with this simple but devastating line that I just can't shake. How did it come to this? And it's something I keep thinking about, in particular around schools. We have millions of kids out of schools. And to me, there's no bigger story right now. It is a national emergency. So back to your opening line from that article. How did it come to this with schools? And how do we do it better going forward? How do we course correct?
Yeah, I think that's a really good point. I have some scattered thoughts about schools, which I'm only now coalescing. So forgive me if this is a bit rambly, but I think one of the problem, I think the schools problem, the fact that we still don't actually have a huge amount of a lot of clear evidence around schools as possible sites of transmission, around the role that children play in transmission. The fact that there hasn't been a really massive, coordinated, large-scale study of the kind that the US can potentially pull off to answer these crucial questions is something that we're really going to have to look back on and pull apart. Back in March, people were saying, this pandemic is going to be around for like a year or 2 years. Like, it's going to take that long to get a vaccine. So obviously, it's still going to be a problem at the time when schools are going to reopen. We know that child development is very, what's the right word? It's very dependent on those early years. If you set people back, those effects can cascade for perhaps the rest of their lives. Why in March didn't people think, okay, schools are an obvious priority. That's the thing we work towards. We need to get the studies in play that will answer those questions. We need to, we need to put in place the public health measures that will allow us to make school opening a reality. But those things sort of didn't happen. And I think there's probably a large number of reasons for that. I think a lot of the pandemic response has been dominated by short-termist thinking, like this hope that it's just going to be over in a couple of months, that a lockdown period will stop it, or that, whatever magic bullet we hope for is going to stop it. And I think there wasn't that sense of I'm not sure people like policymakers and people in positions of power truly internalized that this was going to be a very long struggle and that we needed to plan for the worst possible outcomes in like the fall rather than the summer. I think that there's also, I spoke to a social epidemiologist who noted that partly this reflects like the biomedical fixation that I've already talked about, right? This idea that we're looking specifically for therapies and vaccines, and like social epidemiologists are much more geared towards like things like the life course, right? Like, so how the kinds of disturbances I've mentioned at a very young age can cascade through the rest of a person's life. And I think if you take that very broad societal view that people like sociologists and anthropologists and social epidemiologists provide, you start realizing just how important schools are. So it's not just about, you know, will teachers get infected or not, but it's, are you going to screw over a generation of kids? And the stakes become much, much higher. So I think there's a large number of different factors at play here, but I think I think Joe is right that we really didn't do well on that question. And I think it reflects, it's an indictment of the short-termist nature of a response, the way in which we would love to believe that people's scientific priorities are entirely stem from scientists' own passions and their desires to help society out and for the greater good and all that. But really, a lot of it comes down to things like incentives, you know, where the funding is going into, what the priorities are at the time. Like, why did so many people rush into COVID research and do endless trials of hydroxychloroquine, and no one sat down and went, okay, we need a massive study about we need a massive study that addresses the schools question, and we need to do it right now. You know, why did it take so long, and why are those studies still, like, you know, to my knowledge, not being done to the degree that we want them to be? How do we go forward? I don't know. I think that the need is clear, and I think also the need to bring in people from a wide variety of disciplines, beyond just the biomedical, to also include the social sciences and all the other areas that are necessary here, is really important.
Well, along those lines of communication, we have another question from Vish Viswanath, professor of health communication. Let's take a look.
Your article brilliantly and cogently summarizes the failures at various levels, political, policy, and health system levels. One other area that has not come up often for discussion is our ability and capacity to communicate science. To a large extent, it was also a failure in science communication. What lessons have we learned, and what can we do going forward?
Yeah, the question is sweeping in scope, I think, because I would encourage everyone listening to this, especially folks who actually work in the sciences, to realize that the key to answering this question is to recognize that science is not a single monolithic entity, right? So the question of communicating science or being anti-science, or, you know, any rhetoric around like the war against science, I think glosses over this idea that science is many things. You know, it is a way of accumulating knowledge in the world. It is the actual practice of publishing papers in journals. It is a number of different disciplines, many of which are at play in the pandemic. It includes folks who are saying things that are correct and empirically grounded, and also a lot of the people who are not. You know, it's not just the case that the pandemic is about science versus anti-science, or that the communication of that is about listening to the science. I think understanding that science is a very multifaceted entity and very much a human endeavor is critical here. I think also one of the most important lessons that I've learned over this year is that the pandemic is not just a science story, and it is very wrong to pretend that it is. Like, clearly, virology matters here, epidemiology matters here, immunology matters here. But this is also a crisis that touches on every aspect of our society. You know, it affects our culture, our education system, the media. Like, everyone is personally affected, and every discipline is affected. And so, the work that I've tried to do touches, includes science, many disciplines of science, but also draws from a lot of the social sciences. It draws from, sociology, from anthropology, from linguistics, from history, from all of those fields. And I think that's what we need, like a massive investment in cross-disciplinary thinking and synthesis to help really make sense of what is going on. I think if we just see this as an act of science communication, we're only getting one small part of the picture. And I think what we communicate to people is incomplete. I'm trying to think what the other part of this that I wanted to talk about is, but I've sort of lost the train of thought. Let's go to the next question, and I'll see if I can remember the other thing that I wanted to say about that topic of communication.
Well, so we have a question here from a fellow at the Nieman Foundation for Journalism, Vidya Krishnan, who has another question for you about how you do your work.
Okay.
Mr. Yong, I want to start by thanking you because your reporting has been consistently instructive and measured, and it has helped me make sense of events back home in India, where I'm a health reporter covering the pandemic for LA Times and The Atlantic. And my question to you is about the process of reporting a story of this scale. I'd like to understand how what happens behind the scenes, because the news is developing at the pace that it was, and how do you go around taking a long view of the events the way you've done in How the Pandemic Will End?
Yeah, so this is a great question, and I think the crucial part of it is recognizing that. So our editor-in-chief, Jeff Goldberg, has long said that The Atlantic is a place where people don't come to read the news, they come to learn how to think about the news. And that, we are not a huge newsroom. And I think one thing he said recently is that we are too small to do anything but go very big. And that is something that I've tried to bear in mind since the start, since coming off book leave and starting to really, truly focus on the pandemic in mid-March. I've tried to not get caught up in the very fast drumbeat of the news, and instead try to look out on the horizon at what is to come, and to do big pieces that will hopefully ground our readers for this very difficult moment, and to give them a stable footing for the months ahead. I've used this metaphor a lot before, but I think I've thought about the pandemic as a torrent or a flood, just these raging waters that are threatening to sweep us all away. And good journalism, I think, can act as a platform in the middle of all of that, so people can stand on it and just take a minute to catch their breath and observe what is happening without being swept away and drowning in it. And that's what I've tried to do. I've tried to do pieces that are going to be resistant to, to the very fast-moving pace of things. So rather than just like, here is a new thing that is happening, here is a new thing that is happening, like stepping out and answering the big questions, like how the pandemic will end. Why is this so confusing? Why are we still stuck in this rut? As Joe said, how did it come to this? That big magazine piece, I wrote that in June, and we sent it off to the printers in early July, and it came out in mid-August. Now, a lot of stuff happened in that interim, but we specifically designed the piece so that it was going to be timeless and that it wasn't going to be instantly outdated the moment it came out. How do we do that? Partly it's there's a lot of work beforehand of just trying to look at what is actually immersing myself, like drowning in it myself, looking at what people are talking about on Twitter and in other media, and trying to get a sense for like what are the big questions, like what is the zeitgeist now, and where is it likely going to head in the future. Interviewing a ton of people. So I talked to dozens of people for every story. The one I'm currently working on, I've done like 50 different interviews. And then just spending a huge amount of time structuring and outlining. So I'm a massive structure nerd. And like every big piece that I write, I have a very, very detailed breakdown of what like every section is going to be. I have a master document that has all those sections laid out, that has all the interview material I've gained, all the extra reporting and papers and sources that I found, all slotted into place. Like I basically know more or less what I want every paragraph to be before I start writing these pieces. And it makes the process of writing that much easier, but it also allows me to do a lot of the conceptual work. I was telling my wife the last time I worked on a big piece, like I was complaining about the fact that it was very, very difficult, and she pointed out that that's because writing these pieces isn't just like writing a normal news story. In many ways, it's sort of like doing a thesis. Right, so it's the pandemic spiral piece that I wrote is sort of an act of, I don't want to be self-aggrandizing about it, but it's a piece of knowledge creation, right? So it's trying to actually look at what is happening and synthesize and organize it in a way that isn't just writing down what is happening, and that it takes a lot of work, and doing that structural work at the start really helped with that. And I think there are other reporters who do this incredibly well. So, and not just reporters, scientists, like Zeynep Tufekci is someone who I think has done absolutely monumental work on this. And she also talks about this idea of synthesizing, of creating knowledge and organizing knowledge where it previously either didn't exist or was in disarray.
Well, on that question of process and people you speak with for these pieces, we've got a question from Caroline Buckey, Associate Professor of Epidemiology. Here's what she asks.
This pandemic has really exposed some of the underlying societal biases, both sexism and racism, and a propensity only to hear voices from the global north. I'm wondering how we can improve this lack of scientific perspective in the public consciousness from some of the best scientists in the world who are women, minorities, and from the global south. What are the things that we can do to improve scientific communication in such a way that we can elevate some of those scientific perspectives from some of the best scientists in the world?
This is a great question and something very dear to my heart. I think I'm going to leave the global south piece of it aside, because while I think it is very important, it's also not something that I think I've been very good at, mainly because I work on an American magazine, and much of the focus of my pieces has been on the US. In terms of sexism and racism, I very much believe that those are huge parts of both of the areas that I am immersed in, science and the media, and I've written about and tried to put into practice. So I've written about the fact that a lot of reporters, and myself included in the past, have overly represented the voices of white men in our pieces. When I first did this exercise, tallying up the sources of my work several years ago, I think it was a ratio of 3-to-1 men to women. The vast majority were white, and I think that ratio is exactly what you find when almost every reporter does that same kind of exercise. And I now track like the proportion of women and people of color I talk to who are quoted in my pieces, but every piece that I do. I can tell you that across the pandemic pieces I've written, 65% of the sources are women and 25% of people of color. And it's not hard, right, to do that. Like this is, these are areas like public health, like epidemiology, sociology. The ones that are most relevant here are immensely if not dominated by, then full of incredibly talented, very, very senior, very, very intelligent women and people of color. And so it's almost like, I don't know, you almost have to be like trying to not include their voices. And it's a bit ridiculous that that a lot of people don't. I think it is also, the other element of this, of course, is that women and people of color have been in academia have been severely disadvantaged by this pandemic for different reasons. So women scientists have to do, women in general in the workforce have to do much more of caretaking responsibilities than men do. And that's not just in terms of childcare, but also in terms of taking care of elderly relatives, acting as emotional support for friends, for students, for colleagues. Women in science have to do a ton of more teaching responsibilities. And if you add that on top of all of the systemic disadvantages that they've long faced in the academy, it's no wonder that, women scientists who have expertise on the pandemic itself are struggling more than men are. And that those who are not in relevant fields have found it much harder to pivot because they've just had more to do. People of color have exactly the same issue, but on top of that have the extra emotional burden of being much more likely to know people, friends, family, colleagues who have actually died from the pandemic. They are even if they themselves have not been directly infected, they are suffering the emotional burden of the disproportionate toll that the pandemic has wrought on people of color. And also a lot of them have to, are dealing with institutions that have only this year suddenly discovered that racism exists and are therefore calling on faculty of color to perform all kinds of extra duties to help them address those problems that, that on top of all their existing responsibilities. And that sort of leads me into one answer in Caroline's question, where she asked about, what can we do? And I sort of think that, yes, everyone can do something here, or every journalist can start doing the kind of record keeping that I've suggested, can actually look at their numbers and make a specific effort to center the voices of women, people of color, people from the global South, other groups that we don't hear enough from. People in those communities, I think this was more of a problem pre-pandemic, where in sciences, women and people of color were much more likely to say, I'm not an expert here, please talk to this person who actually is, and turn down interview requests. I'm not seeing almost any of that during this crisis. I think everyone wants to help. I think we can all do our part in terms of like highlighting the voices of people who are experts, who are not maybe getting enough attention. I see a lot of this happening on Twitter, and it's great. I have sources who, if they can't do an interview, will recommend other people to me to talk to. I often specifically ask people, including some of the people who have asked questions today, like who are the people I should talk to? I specifically want to hear from women and people of color. I have turned down speaking requests and interview requests and given the names of women and people of color to in replacement. Those are all things we can do. I do want to note that the responsibility here should disproportionately fall on men and on white men in particular, right? It shouldn't be on, the burden of fixing inequalities shouldn't fall on the people who've been disadvantaged by those inequalities. It should fall on the people who have privilege, who have power, and who have gatekeeping roles in these environments. It should be people like me. It should be people like us. It should be people, who are in higher administrative positions in academia, who are busting their guts to address these problems. And instead, I think that a lot of the efforts have disproportionately come from people who are themselves being disadvantaged, which is ridiculous, to the extent that I am a beneficiary, and I absolutely am, of systemic sexism, then it is my job to try and dismantle it. And yeah, I think, we all have a part to play. And I think, like, I have an extra part, and I've been trying to do that, but we can always do more.
Well, I remember when you detailed that breakdown in your stories and the sources that you talked to, and I wonder, have you observed a difference in your stories and your work at all as a result of ensuring better diversity in the people that you're talking with and quoting?
Yeah, I think so. I think this is not just, like, even if this was just a social justice issue, I think that would be enough to make the effort. But I think also it makes the science better, and I think it makes the journalism better. I think when you bring people in who, traditionally haven't had a voice and who've been who have been marginalized, you get new perspectives, and I absolutely get that in the work that I do. I think if you only go for the people who already have the biggest platforms and who already have the loudest voices, you just get, like, repetition. You start hearing the same things again and again. And when I branch out, by including more including more people of color, by including people from other disciplines that I've not heard from before, I hear new things. And I think one crucial thing to remember here is that the solution to these problems cannot just be, I learned the names of, like, 5 women who I talk to all the time, because those 5 women, I guarantee you, have requests from every other journalist in the world and are also being asked to do talks and interviews and everything else. So, like, every big piece I've done, I think I've tried to ensure that somewhere between, like, 30 and 50% of those sources are entirely new, like they're people who I've talked to for the first time. And yeah, there are absolutely stalwarts who will go back to it and again because they're great. But I'm always trying to talk to new people, and that helps me. That exposes me to new ideas, and for the same reason, I think that's one of the reasons why pushing for greater diversity is so important.
Mm. Well, we're just about out of time, and I guess I'll end with a question I'm a little bit afraid to hear you answer, but I know you'll be honest with us because that's what you do. Given where we are now with the pandemic, are you feeling optimistic about progress being made, or are you feeling worse than really you ever have about where we are?
I wouldn't say I'm optimistic. I think that look, we're in a bad situation. We have cases rising again. Hospitalizations are rising. I think one of the things that I'm really worried about, and that probably isn't getting enough play, is this issue of burnout. We've already talked about this a bit. We've talked about it with Fauci and with others. Expertise is a finite resource. We treat it as a sort of nebulous concept, but it exists in the heads of actual people who have been working non-stop since January. Those people are very tired, and they cannot do this forever. Like, I can't do this forever. This pandemic has been ruinous for my mental health, and the same is true for, I'm sure, I don't want to put words in your mouth, but
like that over here too.
Right. For many of us, journalists, scientists, for healthcare workers, and it's, I think we have inadequately grappled with what that's going to mean for the months to come. When you have healthcare workers who really haven't had a break since January, now dealing with a new surge of cases, still not having enough PPE, still having to suffer like the demoralizing nature of a pandemic that has not been controlled despite their best efforts. What is going to happen when those already overstretched people start to snap? I am very, very worried about that. Optimistically, many Americans really have done the kinds of things that we needed people to do. Masking is surprisingly common and surprisingly supported. So is social distancing. Like, I think there's still a lot of a lot of miscommunication, a lot of misinformation, a lot of people actively in opposition to these measures. But in some ways, the endorsement of these very different means of living, from zero to majority acceptance in a matter of months, is a testament to how adaptable and pliable people are. And if only we could have had actual leadership on top of that, we would be in a much better situation. So, I don't think it's not that like everything is apocalyptic, but I do think that we are in a bad place. It's probably going to get worse before it gets better. And I worry about the spiral that I wrote about, that we are just trapped in these errors of intuition and are sort of destined to make the same mistakes again and again. And that, that we are going to be inured to this fact of losing hundreds of people every day to a thing that we actually know how to contend with. I think that's a enormous tragedy. And I don't see an obvious resolution to that, at least in the near-term future.
Well, Ed, we really appreciate you spending this time with us. And this has been a great conversation. And I'm sorry to everybody whose questions we couldn't get to. We just had a lot to talk about. Ed, thanks again.
Thank you so much for doing this. These were great questions. Really appreciated you taking the time as well, Meg.
Oh, gosh. Well, it was my pleasure. And I want to thank also Deans Michelle Williams and Jane Kim. And thank you, of course, to our audience. You can watch this later on demand on Facebook at Harvard Public Health, the Harvard Chan YouTube channel, and on the forum at the Harvard Chan School website. And join us again on December 9th when Dr. Anthony Fauci returns. And join us on February 1st, 2021 for a discussion with Pulitzer Prize winning author Isabel Wilkerson. Thanks again, everybody.